We've done it for years and we've been doing it wrong. I'm talking about treating upper respiratory tract infections like sinusitis, bronchitis, the common cold, and sore throat with antibiotics. For example, new guidelines from the Infectious Disease Society of America declare that 98% of acute sinus infections are caused by viruses and should not be treated with antibiotics. Here's what you need to know. Antibiotics attack and kill bacteria, but are ineffective against viruses. In other words, antibiotics are ineffective against 98% of the germs that cause sinus infections. Despite this well-known fact, many doctors still treat these common infections just in case they are bacterial. In addition, doctors are prone to cave into patient demands for antibiotics, even though they may be certain of the antibiotics' ineffectiveness. Unfortunately, no simple tests are available to differentiate bacterial versus viral when it comes to sinusitis, so doctors need to fly by clinical judgment and make a best guess in most instances. It's a perfect storm for bad practice. The use of antibiotics for viral infections increase bacterial resistance to antibiotics, increase the cost of care, and substantially increase the risk for adverse effects like antibiotic-associated diarrhea, which in many instances requires hospitalization and very expensive antibiotics for treatment. The infectious disease guidelines specifically recommend against using commonly employed antibiotics like Bactrim, the Z-Pak, and Septra, and recommend as well avoidance of decongestants and antihistamine to treat upper respiratory tract infections. So what should you do? I recommend avoiding doctors altogether unless you have persistent chills, a fever of 101 or greater, and cough or nasal discharge of green or brown mucus. Then go to bed, drink copious fluids, and take zinc with vitamin C. And for questions or comments, email me, Dr. Jim, at drjimshealthline.com. Then be healthy, be happy, and join me next time on Healthline Today.
Opinions on this station and the web of Dr. Jim Linhart are educational and informational and are not a diagnosis, treatment, or substitute for professional medical advice. Consult a physician or healthcare professional for your health or medical needs.